Hi, everyone, and welcome to the Charleston County Coroner Candidate Forum with our candidates Frank Bracolo and Herbert Fielding. This is our only county-wide forum that we're going to have, and it's being co-hosted by the Charleston County Democrat Party, as well as all of our area clubs. And this is the kickoff to our North Area Democrat Club relaunch. So we're really excited to have you guys join us here this evening. My name is Kelly Gorby, and I'm the chair of the East Cooper Democrats. And I'm so excited to introduce you all to Smarell Nicole Brown, who will be the chair of the North Area Democrats. And she will be leading that group along with Celia Ballou. She's the precinct coordinator in the North Area. Smarell might be someone you guys already know. She worked on the Steyer campaign. She's had some businesses around town, and she also has Raising Sages, a children's nonprofit, and she's super excellent. So I'm going to hand it over to Smarell so that she can introduce herself.
First of all, thank you, Kelly, for spearheading this. I would not have been able to launch my first event without your brilliance. So just so much for everything you do with CCDP. And thank all of you that are tuning in, but a special thank you to our two coroner candidates. I did a little bit of research because, honestly, I didn't really know much about coroners, as I'm sure a lot of people do. But doing a little bit of research, I learned some things from actually Fielding on the fact that a lot of our data, and I'm a health nut, and knowing that a lot of the statistics that we gather that really do impact our well-being has a lot to do with what you guys find. So first of all, thank y'all for the commitment to the work that you're doing. And thank you as well to Mr. Sajid, who is the vice chair of the Charleston County Democratic Party. And thank you to everybody else that's tuning in. We really appreciate you guys for being concerned and engaged citizens. And then also a big thank you to the mentors that I've had, like Brandon Upson and several people that have paved the way for me to be here today. So, Kelly, I guess you can go ahead and get started with the first question and tell them the rules of how we're going to get started with this.
Okay, so our format for this evening, each of our candidates will have 2 minutes for their opening statement. They will also have 2 minutes per question and 2 minutes for their closing statement. And Smarell and I will use our phone timers to time the minute. We will just let when the is over. That is no indication or reflection of the answer that's being given. We just have to stay on track for the evening. They've already gotten the questions, and so we won't be taking any questions from the chat like we sometimes do. And then we're going to alternate who gets to start first. So that being said, we're going to get started. We'll start in alphabetical order with our opening statement. So Frank Bracolo, it is.
Thank you. Thank you to Smarell, Kelly, and Sajid. I appreciate you guys hosting this very important candidate forum. My name is Frank Bracolo, and I'm running for Charleston County Coroner. I live on Johns Island, and I'm in my 19th year of proudly serving the citizens of Charleston County as a frontline first responder. I am running for Charleston County Coroner because I want to continue my commitment to public service as a voice for the deceased and an advocate for surviving family members. Electing the most qualified Democratic coroner is very, very important because it is the coroner's office who accurately has to determine a cause and manner of death to list on a death certificate. And therefore, we need to choose somebody who has the experience and educational background from day one to enter this very important elected field. Again, my name is Frank Bracolo, and I am the most qualified candidate for Charleston County, and I look forward to this forum tonight. Thank you.
Mr. Fielding?
Hi. Just go ahead. Okay. Well, thank you for having me here, and I appreciate the opportunity to speak. I am a Navy veteran of Vietnam. I've worked in employment. I've worked for several candidates for office. I am an administrator. I do differ with the fact that the coroner's office is all medical, because the determinations that are made in the coroner's office are made by the medical examiner. I've been 28 years in public service. I'm a small business owner. My family has been in the funeral business for 108 years. I am a Democrat. I've worked on every campaign, every presidential campaign from John Fitzgerald Kennedy till today. I have the experience and a high level of experience in administration. And this office definitely needs an administrator. It needs someone to administer to the office. I thank you, and I look forward to the discussion we're about to have.
All right, thank you. I'm going to turn it over to Smarell, and she is going to ask our first question.
All righty. In the midst of this health pandemic and in recent news, we see that minorities are dying at disproportionate rates. Explain to our members why, when some of us feel like our lives are being valued more when we are a hashtag. Why should they care who is elected coroner?
And that would be on me. If the pandemic has proven one thing, we are not sharing information with our communities. The particular office is not educating this community as to comorbidity, and we're dying at an amazing rate because we have a poor healthcare system for most of the persons of color, and that's what's leading to this pandemic being such having such an effect on communities of color. That the information that's collected by that office needs to be used to teach the community, and you need to be able to access the community, which means diversity. The office is not diverse. So an administrator would need to make sure that it's diverse so that you can get those persons into these communities to keep people from, ending up on the coroner's table.
Thank you. Mr. Barlow, same question.
Thank you. First, I equally value every single member of our community. Everybody is just as important as everybody else. And I truly do care. And as I have proven during the past 19 years as a frontline first responder and public servant who has been serving diverse communities throughout Charleston County, I'm a dedicated public servant ready to help. COVID-19 has shown that we still have definitely inaccess to healthcare facilities and medical care in our rural communities and basic infrastructure, such as water, sewer, and septic tanks that are leaking into our waterways. Therefore, we need to have a coroner who is prepared in this office from day one to help the citizens throughout this tragedy and any others. Thankfully, Charleston County, we have been very fortunate to have not seen the devastating effects of COVID-19 on our community like some of our other communities such as New Orleans and New York City. At the 4 o'clock update today on DHEC's website, thankfully in Charleston County, we have had 578 positive deaths, but thankfully only 12 deaths and 578 confirmed cases. Citizens of Charleston County should absolutely care who is elected coroner, because we need to elect the most qualified candidate who's prepared for a potential response to COVID-19, but also any other infectious disease response that may occur, or natural event disasters, or any man-made tragedies. Thank you.
Thank you. So our next question is from the East Cooper Democrats. It is tweaked a little from what you saw last night, but it is along the same lines. And this one we'll start with Frank, and then we'll go to Herbert Fielding. And just as a reminder, if we can all put ourselves on mute when we're not on. So question number 2. Conduct investigation within communities of color, and how will that impact how you conduct investigations as coroner?
Kelly, can you repeat the question? You cut out.
Yes.
Right.
Do you have any experience conducting investigations within communities of color, and how would that impact how you conduct our investigations as coroner?
Okay, thank you. Absolutely, I do have the investigative experience. And the coroner's office, they are a part of a response team that investigates sudden and unexpected deaths occurring within Charleston County. In the investigative process, it's a collaborative process. It's a team effort that relies on input from various resources, such as EMS, fire departments, law enforcement, physicians, nurses, family members, and friends. Every single one of these entities is a very important and intricate part of the team that involves the investigative process. Therefore, that's why we need somebody with frontline first responder experience, and we need a scientist. The coroner's office is a forensic science specialty that is out in the field investigating crime scenes and medical and traumatic causes of death. With 19 years of experience with EMS, I'm currently the night shift supervisor with North Charleston and West Ashley portions of Charleston County, and I deal with death almost on a nightly basis. And whether the death is related to a medical or traumatic cause, as a paramedic, I'm out in the field and I'm an intricate part of the investigative process. Nearly every single night I'm interacting with the coroner's office in these important tragic deaths.
Thank you. Okay, same question will go to you, Mr. Fielding. Do you have any experience conducting investigations within communities of color? And how would that impact how you conduct investigations as our coroner?
Well, I have lots of experience. I am, of course, an African American, and I worked in the public defender's office for about 6 years as a special investigator. I did crime scene investigations. I did investigations. I even met with the medical examiner because I had experience in physiology and anatomy. The one thing that I can tell you is this office, as it exists right now, doesn't have that kind of access because they're not, the number of persons that have to be investigated is a small function as far as the total overall death in the county. There are thousands of people that die in the county, but there are only a small amount of autopsies. So if everything is concentrating on autopsies, you're leaving out 82% of the population, which is all different kinds of diverse populations. And I do have a considerable amount of experience in the area of investigating, but it was for the defense. It wasn't for the prosecution.
Thank you, Mr. Fielding. All right, Smarell.
Okay, I'm guessing this question will go to Mr. Broccolo first. Why are you, or should this go to Herbert first? Should go to Herbert?
Mr. Fielding.
Why are you uniquely qualified for this position?
Over my 28-year career in public service, I have worked several different agencies. I started at the State Attorney General's office as a special investigator. I left there and went to the Public Defender's office. I left the Public Defender's office and went to the South Carolina Commission for the Blind. The South Carolina Commission for the Blind was 26 out of 26 in this state when we took over. Within 2 years, we had put that agency at number 2 in the country. I know how to work. I've done desk audits. I know personnel. I was personnel director for a year at the Commission for the Blind. I'm IT experienced. I built their network. I have a unique set of skills accumulated over a long period of time that will allow me to address the problems that are existing in the current coroner's office. I look forward to the challenge.
Thank you.
How much time?
Why are you uniquely qualified for this position?
Thank you. First of all, I'm already a nationally certified medical legal death investigator. I'm a graduate of the University of Florida's Forensic Science Death Investigation Certificate Program. I'm a graduate of the Death Investigation Training Academy. I'm a nationally registered paramedic. I'm a candidate for a master's degree in forensic science. I've already completed a master's degree in biomedical science, and I have a bachelor's degree in biology. My community involvement, besides my 19 years as a EMS division chief with Charleston County currently, I'm also a fire commissioner on the St. John's Fire Department Commission Board. I'm also a commissioner on the Firefighters Insurance and Inspection Fund. I'm a board of directors member for the Ashley House of Charleston, and I have experience as a research scientist at MUSC. So I have both experience in the field, frontline every night, as well as the educational background as a scientist and medical provider to lead this office from 2020 and beyond.
Thank you. And I want to thank that question came from the James Island Democrats, so thanks to them as well. Okay, so our next question is another one from the East Cooper Democrats, and it will start with Frank first. What is the biggest issue facing the Charleston County Coroner's Office?
Well, thank you for this question. This is a very important one. I just this morning finished a 16-hour shift with Charleston County EMS, so I'm out there every night, and I'm seeing exactly what our issues are firsthand. And number one is the unexpected and sudden deaths occurring with Charleston County. Due to gun violence, we are losing way too many young teenagers, young adults due to unnecessary gun violence that needs to stop. And also drug overdoses. Every night, multiple drug overdoses occurring throughout Charleston County. It doesn't matter if you're in North Charleston, Mount Pleasant, or Johns Island. And the way we're going to stop this is the coroner's office has to be a very important portion of the community outreach and educational programs so that we can prevent these events from occurring and the senseless tragedies that are occurring nightly in Charleston County. And the way we're going to do this is the coroner's office, when I'm elected, we're going to be out there, our deputy coroners and myself, we're going to be out in schools, we're going to be out in churches, we're going to be at community centers, and we're going to be working with law enforcement, EMS, fire departments, letting people know about the dangers of gun violence and senseless loss from overdoses. This is an epidemic in Charleston County, but also throughout the entire world right now. And the coroner's office needs to be on the forefront of prevention and outreach in this terrible, terrible ongoing tragedy.
Thank you. Okay, Mr. Fielding, the same question will go to you. What is the biggest issue facing the Charleston County Coroner's Office?
I think this is pretty easy answer. First and foremost, I've managed at a level at the Commission for the Blind. We were a $60 million agency at one point in time. The biggest issue that is in the office right now is diversity. There's a serious lack of diversity in the office. It does not do enough community outreach based upon a $2.5 million budget expenditure. You're not seeing the kind of outreach coming from that office that it should be, because these persons are well paid and they're not participating in the communities. The office needs to be automated. If you go looking at their website right now, there is no way to interact with that agency, not by the data, or even you have to call them on the telephone. That is the basic use. So I think that, given my experience over the extensive period of time, I know how to do audits because I was a program auditor at the South Carolina Employment Security Commission. I would audit the agency for the monetary inefficiencies and the diversity issues and correct those issues immediately.
Thank you. Okay, Smarell.
Okay. This question goes to Mr. Fielding first. How will your administration improve how the coroner's office conducts its business?
I have just received both a Democratic, the Congressman Jim Clyburn. I've received his endorsement, and I've also received the Democratic candidate Jamie Harrison. I have some 50 endorsers to me as accredited candidate, as a qualified candidate for this position. I would improve the office. Basically, I would make it much more transparent. The agency needs to use the expensive information that they're collecting to teach the community about gun violence, to use those facilities to show young people what happens when you have obesity over a long period of time. And of course, we have a serious drug problem in Charleston that is causing many of the deaths in young people. So the agency needs to change its pattern. I mean, the pattern that's existing right now is what it was in the 1600s, some kind of investigative unit. But we now have a medical examiner and we have a police department. And those two agencies can do most of the investigation. The information that comes from the coroner's investigations needs to be used to the public, needs to be transparent to the public.
Thank you. Mr. Broccolo, how will your administration improve how the coroner's office conducts its business? Sorry.
Thank you. First of all, when I'm elected coroner for Charleston County, #1 priority, I will definitely build a team of the death investigators that is reflective of the community we serve. Also, I'm going to foster a collaborative environment. We have so many important partner agencies out there, such as the Coastal Crisis Chaplaincy and the Charleston County Volunteer Rescue Squad. The coroner's office is going to be intricately meshed with those departments and working together with those volunteers and those important services that will benefit the community. And also, like I said earlier, I'm definitely going to increase participation in community outreach and educational programs. We already talked about gun violence. We talked about drug overdoses. Also, drunk driving, unfortunately, continues to be a problem throughout Charleston County, as well as mental health awareness. The coroner's office needs to collaborate with these partner agencies so that the numbers of deaths can go down in Charleston County, and it's a team effort, team approach that takes multiple agencies, not just the coroner's office. Thank you.
Thank you. And I want to thank the West Ashley Democrats for putting that question out. So based on the time, I think we could give you each 1 extra minute and have 3 minutes for your closing statements. We will start, I guess, with Mr. Broccolo. Say your last name for me one more time.
So it's just like the vegetable broccoli, but broccoli.
Broccolo.
Okay. Thank you, Kelly. So first of all, we do know absolutely for sure we are going to have a new coroner elected on January 1st, 2021. That's going to start office. The current coroner is retiring, so we're going to have a new coroner. The Democrats already know who the Republican nominee is going to be because they have an uncontested primary Republican election. So therefore, the Democrats need to unite and choose the most qualified candidate to win on the primary and then on November 3rd. Because this is a very important position, very important elected office. The outcome of these cause and manner of deaths that are listed on death certificates ultimately affect people's lives. It can place the wrong person in jail. It can deny insurance policies for life care coverage. Therefore, the Democrats need to unite. We need to choose the most qualified candidate to take on a very, very qualified Republican candidate on November 3rd. So the Democrats, please look in to my qualifications, finishing a second master's degree, already a nationally certified medical legal death investigator. I'm on the front lines in Charleston County working in diverse communities for the past 19 years. I am absolutely 100% the most qualified candidate, and I am ready from day one to enter this office and provide a service to the community that will be reflective of the community and proudly serve all citizens of Charleston County. Thank you.
Thank you. Okay, Mr. Fielding, you can have the floor for 3 minutes.
Well, I think first off, I need to explain to you, I've already unified the Democrats. I have all of the Democratic delegation has endorsed me, except one person. I have 50 endorsers. I also have support from Republicans at this point in time. This is an elected position, and it's going to have to be able to win. Democrats are going to have to put up a really good candidate. And I think I am that candidate. My experience is administrative, and it is in governmental agencies. I understand what is necessary here. The concentration on medical, logical investigation is not serving this community that well, because that kind of information is what we're making a decision on. That comes from the medical examiner, and it comes from the police, and to a certain extent, the information that the coroner's office can investigate or glean. The other side of the question is we're spending an enormous amount of money on medicological examinations. When you look at the budget, it's almost $1 million is spent because we have or had a process at the medical university where we were training forensic pathologists in the medical university and also doing those doing the autopsies at a much lower rate. A private autopsy is $5,500. An autopsy under the contract at the medical university, which my brother ran the morgue, that's why I know, was about $1,800. But we are continuing to do expensive, very expensive autopsies in Charleston in the coroner's office when it can be done much cheaper at the medical university. We are duplicating evidence. And as I know from the court system, anytime you're handling evidence, you want the chain of custody because that's most important to the case. And we're keeping evidence at the coroner's office and evidence at medical university, when the medical university is much more qualified and better suited to do that. So there's some things that need to be administered to as a public official who is trying to get the most bang for the constituents' buck. And we are not doing so at this time. I have been very successful in program management, and that's what I'm looking for. I'm not concentrating. I'm not trying to tell you that I'm going to be a doctor. I'm not going to be a doctor. I'm going to be an administrator.
Thank you. Okay, y'all, thank you so much to Herbert Fielding and Frank Broccolo for joining us this evening. I want to thank the Charleston County Democrat Party and our area clubs as well. Thanks to those who helped give us some questions for this. And thank you to the North Area Democrats. If you want to find out more about any of our candidates, you can go to the Charleston County Democrat webpage. And
well,
Smarell?
My website is herbertfielding.com, and it's an extensive website, and it explains my position, and I would invite anyone to go there, herbertfielding.com. Thank you. I really appreciated this.
Thank you. Thank you both. Smarell, how can they find out more about the North Area Democrats?
So to find out more about the North Area Democrats, you can go to our Facebook page, which is also named North Area Democrats. And you can also find us on Instagram at North Area Dems or North Area Democrats also. Mr. Broccolo, what's your website?
The website is electfrankbroccolo.com. electfrankbroccolo.com. Thank you.
Thank you. Some of you will probably be hopping off, but we do want to let you know that the West Ashley and North Area Democrats are having a County Council 6 candidate forum tomorrow, starting at 6:30, and you can get details on mobilize.us. So thank you.